public to the board. And before we start, I do have to tell you about this meeting being webcast, and a record will be retained on the council website for up to 2 years. By participating in this meeting, you are consenting for your name, the content of what you say and your image to be broadcast and stored to the council website. If any of you have any concerns with this, please contact our committee services officers straight away. If people are at home viewing this, I would like to let you know that if you look above the video, you'll see a resources tab. If you click on this, it will be a link to the agenda, and that will help you to follow the debate and the discussion. So, thank you. Can I remind you, if you're speaking, please turn your microphone on so that you will be captured on the webcast. And if you're not speaking, please remember to turn it off, because otherwise we get feedback. So, can I ask now if any members need to declare any disclosable pecuniary interests in connection with any item on the agenda? No? Right. Apologies. Now we have quite a few apologies, understandably, given the escalation of the current position in respect of the COVID response. So we have apologies from Councillor Anderson, from Karen Pryor, from Janelle Holmes, Sir David Henshaw, Karen Howell, Sue Higginson, Mike Mayer, Matthew Swanborough, Louise Healy and Paula Cowan. I've got Graham Hodkinson on my list, but he's here, so we don't have, unless you're going to apologise for being here, Graham. Very fortunately, we've got Val McGee, hi Val, and Tony Bennett, who are here in place of Karen Howell and Mike Mayer, so warm welcome to both of them. If I can move on next to, is there any other apologies that I haven't mentioned that anyone knows of? No. To the minutes, if we could approve the minutes of the meeting that were held on the 3rd of November. I'm happy to move. To have a seconder. Councillor Gilchrist, thank you. I've not been given any notice of any public questions, statements or petitions. So that moves us on to an item that I'm very much looking forward to. I've been looking forward to for several weeks now, which is our children and young people with special educational needs who are going to talk to us or explain to us about their experiences of the pandemic and give us a short presentation. And Simone, you're going to introduce this item. Thank you.
Hello, thank you committee, and thank you for this opportunity, Chair. We have in the room with us today some members of our Wirral Send Youth Voice. Listening to children with special educational needs is a really important way of understanding the impact of our services, their day-to-day lives, and how we can shape services to be different and to deliver what they need to allow them the opportunities that all children and young people should have in our society. During COVID, this group were more challenged than many others. So having a voice at the table and understanding what happened for our children and young people during COVID is really important to us. So the group have come to give you some experiences today, to tell you a little bit about what that was like. But we also hope that this will be the start of a wonderful relationship where the group can come frequently and tell you about progress. So if I hand over to the group to introduce themselves.
Hi everyone, my name is Lily and this is Steve, and we are members of the Send Youth Voice group.
The information for this presentation has been brought to you via different consultations across COVID-19 that was done with young people from Wirral. For example, YPAG June 2020, the Metro Mayoral Liverpool City Region Youth Platform in 2020, Pilgrimbury Online Young People's Event in 2020, Council for Disabled Children in 2021, Kaizen Report for Ofsted in 2021, and the recent Time to Talk event in November 2021.
We are hoping this presentation will give you an insight to the issues of SEND young people during COVID-19.
Firstly, we're going to look at fears and experiences during COVID from a SEND young person's point of view. COVID-19 will get much worse and life won't go back to normal. Support services and organisations for SEND people were weakened and less active in supporting and progressing the life of SEND people. Death of someone I know, things getting dropped too soon, such as support, getting back into routine when back together, a new reality, stress to achieve goals such as exams and tests, changing mindset from being online to groups, from groups to being alone, worried about not getting social life back together, seeing friends and family, worried it does not end and we won't be seeing family again. I fear I won't be able to go to college in September, as I fear lockdown will be extended or be put into another lockdown. That my mental health is going to get worse than it already is, like so many more young people across the country. Getting needles, a baby boom, people breaking social distance, going to fall behind on schoolwork, the second wave of the virus, the third wave of the virus. Now we're just going to look at some case snapshots across COVID.
Young person registered blind has to deal with homelessness. Autistic young person becomes a young mum. Young person diagnosed autistic in lockdown. Self-harming and struggling with mental health. Bereavement during lockdown. Loneliness and isolation issues in most vulnerable shielding SEN young people. Overfearing of COVID-19 affecting behaviours. High-functioning SEND being vulnerable to online predators. Many struggling with changes due to cancellations of appointments, support workers, transport and more. Throughout the pandemic, every SEND young person has had different experiences. We have brought two for you to hear about. The first one is of a young person of secondary school age. The young person is locked out of the country during March 2020 after being on holiday and is stressed wanting to see family. When back at home, family issues with benefits and online processes creates a drop in income. Not being able to celebrate their birthday with friends and family. Because of poor housing, lockdown, family arguments kept happening. There was little space in the house for family. They struggled to access online education due to Wi-Fi cost and technology poverty. Due to having no teacher present at home, they struggled to do online tasks. And the care needs and noise were too distracting to concentrate. When heading to school in September, stressed and paranoid about bringing COVID home to disabled parents. Young person felt that other young people in school ignored COVID safety and distancing. Lots of fake news and fake rumours about COVID. They felt Christmas was cancelled. In the new year of 2021, they were stressed about mocks and revising online. Stressed about poor ventilation in the examination room. Bereavement over parents and social support needed. From this to exams happening and another lonely lockdown birthday. Getting and transitioning into college with support from outside school.
The second experience of as a young person who is over 18. They became very stressed in the first lockdown, low mood and struggled to come online. All support face-to-face sessions with SEND organisations began to close, pause or were rearranged. They had no contact with friends as they either couldn't use technology and or not allowed to mix due to severe vulnerability to COVID-19. The family was concerned as they went from being an outgoing person to becoming an introvert. We supported mum and dad on how to help a young person get into the online sessions. They attended sessions but were struggling. Carers were dropping off and cancelling support for them, leaving them and their families stressed. Due to their disability, change is very difficult. Summer came of 2020 and beginning to go outside helped. They then lost a close family member and were unable to go to the funeral due to restrictions. This affected their mental health further. They attended the online Pilgrimary Festival event and spoke of their mental health and worries in the participation and engagement tent. The family spoke of them needing male support so we could feel part of belonging. By autumn 2020, they were spiralling into a low mood. Their speech and language suffered due to lack of conversation with friends. They then lost another relative. They attended the funeral but struggled in dealing with bereavement. Contact was made with family about offering extra support on one-to-one sessions for the young person. The young person agreed and wanted to do so via dance movement, as they could express their feelings this way better than talking. They started these sessions in November 2020, weekly with a male youth arts worker. The one-to-one sessions continued into summer 2021, where the young person felt they had improved. Mum sent the following message. Hi folks, not too sure who I'm best sending this photo to, but my son has made this poster to all staff at Pilgrim Street and for the local offer Wirral. I asked my son to create something that shows what you've all done to help him and other young people since the start of the pandemic. We made a list of what he's done and what it means to him as a young person with a learning disability. He's also chose the picture of a glitter ball for dancing, the word cloud, and the Christmas crafts pictures. He's printed them out and cut them out and stuck them on this poster. If you'd like to view this poster, it will be on the table at the end of the session.
What needs to be done and supported? Different activities to be more inclusive that disabled and non-disabled can attend and mix in all services and organisations. Hidden disabilities to be recognised and understood more. More varied ways of communication and inclusion explored and learnt to be used by both services and organisations. More opportunities to be sociable and learn life skills. Work experience and future opportunities for SEND need to be improved for aspiration. Help adults and professionals around us to understand disability. Support services for the whole family. More awareness about online safety. More offers on how to be able to engage with online workshops and offers.
Several groups were asked what would be best for SEND young people during the future pandemic. Support with schoolwork, more help with accessing and working technology. Having access to a support base in school with smaller groups and more teachers and workers, and more funding for this. All SEND young people to have an EHCP or an ILP in place, so their needs are assessed and appropriate support put in place. Learning life skills such as money and cooking, etc. Support workers not to be limited or cut off. More opportunities for those with SEND to help others with disabilities. Work experience supporting SEND young people into employment. From this, here are some future thoughts that came from SEND experiences. SEND information to be in one place online.
In a SEND user-friendly form, which is updated regularly.
Versions in paper, braille, picture, audio and video, which is also updated regularly.
Care offers need to make sure cover is provided instead of cancelling the service.
Backup of technology to be ready for service users if any other pandemic happens.
Contact from the professionals and services needs to be a priority.
Making sure disabled families can use technology.
Transport support for vulnerable.
Needs checks on home life such as food, meds, support and wellbeing are all in place.
Awareness of isolation and mental health of the SEND young person. Support calls.
Blended education offers so computer skills are not lost.
Communication between services and organisations and SEND family needs to be consistent.
Awareness that bereavement for SEND young people is real.
If a young person goes through a queue for a service and is ill-fitting or the wrong service, the young person should be transferred to the front of the queue in the correct service by that worker.
The individual effects of disabilities in relation to the type of pandemic happening. For example, trying to socially distance when blind.
High-functioning SEND young people not being seen as vulnerable.
pandemic contact plan for every young person in education and service support.
Those in transition to diagnosis need to be considered to be supported if on waiting lists.
So this was all brought from many different events that happened across 2020 that the Send Youth Voice Group were part of, which Stephen mentioned earlier. And I just wanted to finish with the case in consultation, the lessons learnt in lockdown, which was commissioned by the Council of Disabled Children, which took place during February and March 2021 across the UK. In total, more than 643 children across the UK and young people, 128 parents and 110 professionals contributed their views and experiences. 5 recommendations were drawn from this. 1 was prioritise emotional, social and mental health recovery. 2 was keeping the things that worked well. 3, prioritise family support. 4, return to school safely. 5, a note on funding. And they stated, so we can begin to see and explore possibilities for an alternative vision where we have learned the lessons from this experience and commit to keeping those elements that can work better for children and young people with SEND. Young people, parents, carers and professionals have all recognised that for this to happen, there needs to be a recognition of both the importance and value of supporting our children and young people with SEND. It will also take adequate funding, political vision and will for this to happen. So that was our presentation. So our young people, we had a young person drop out due to their vulnerabilities that have just risen due to the COVID that's coming through. So Stephen stood in for our young person, and that happened on Monday night, so we had a very short notice, but that also shows how that this affects young people with SEND. It's a very real thing that happens. They can commit to something, but drafting another young person in can be, again, really just can't happen because of their kind of timetable and support that they're having. So thank you, Stephen, for that, and thank you, Lily. So, thank you.
Thank you, Stephen and Lily, very much for that. I think we've all learned from that experience, and I think you need to take away the fact that we've listened and that we've heard, and that there are, around this table, a wide range of people from different organisations who are in positions to make things happen. So we are listening to you, we do understand. We do recognise how tough it's been during the pandemic, and I'm so grateful that you've been able to come here today and to share that with us. And the recommendations are here that we will obviously note your feedback about your experiences of the pandemic and the information in the report, and that we will continue to engage with you through the youth partnerships, as many other forms of engagement as we can. But we would want to definitely be a part of the development of the participation and engagement strategy, and we would look to see the final version of that when it's complete. And in the meantime, thank you again very, very much. I'm happy to move those recommendations. Do I have a seconder? Simon, thank you. And thank you for teaching us all a lot this afternoon. You're welcome to stay if you wish. You're also quite free to leave. Right, well, I hope you all found that valuable. I certainly did. And absolutely food for thought, I think, for all of us. Which takes us on quite handily, actually, to item 6, which is Karen and Kevin about working with the community, voluntary and faith sector. Thank you.
Thank you, Chair. My name's Karen Livesey. I've been providing some independent facilitation to the CVF sector over the last 6 months. My colleague Kevin Sutton and I are going to do a bit of a double act today, so I'll hand over to Kevin to start us off.
Okay, thanks, Kevin. As members will be aware, the healthcare bill for 2022 currently passing through Parliament and expected to be on the statute book in April 22, enables the community, voluntary, faith and social enterprise sector within each local authority to play a full part in the local design of service provision as it relates to communities and residents. The principal aim is to address health inequalities, working in partnership with all the key stakeholders. For our sector to play its fullest role, recognising that the sector, from its smallest voluntary group to its largest well-established charities, is estimated to cover around 1,600 individual organisations, and not counting individuals themselves. And the sector needs to develop plans and mechanisms to be able to fulfil its full potential, which is one of the reasons why we're here today doing our double act in respect of this. So, from the background, there's been a number of white papers, the white paper Integration and Innovation Working Together to Improve Health and Social Care for All, February 2021, places particular emphasis on the primary of place and the full involvement of the community, voluntary and social enterprise sector in the development of locally designed and developed systems for tackling health inequalities. In fact, the Health and Care Bill, currently progressing through Parliament, creates the legal framework to support these working practices together. Coming closer to home, the Council's refreshed Wirral Plan for 21 to 2026, Equity for People and Place, was approved by the full Council in September and fully supports these principles, and in addition emphasises the need for communities and residents to play a full part in the local design process. So there's an ongoing theme here on where we're actually progressing towards. By April 22, integrated care boards and service providers will need to have developed formal agreements for engaging and embedding the VCF-SE sector in system-level governance and decision-making arrangements. In fact, it actually makes two key points. Our sector is a key strategic partner with an important contribution to making, shaping, improving and delivering services and developing and implementing plans to tackle the wider determinants of health. VCF-SE partnerships should be embedded in how the integrated care systems operate, including through involvement in governance structures, in population health management and service delivery. Just recently, again, in the last couple of weeks, in the new government white paper, Social Care, People at the Heart of Care, refers to a vision with the need to encourage investment and innovation right across the sector. It states that best practice is already being shown in parts of the country where communities, the voluntary sector, local government, local authorities and providers are working together to deliver new collaborative approaches to delivering services. There is a need to embed this best practice across the country so everybody can reap the benefits. It also sets out a 3-year plan as part of this vision and expresses the need to move at pace early in 2022. Indeed, the Chief Executive of the Council at recent Policy and Resources Committee also expressed exactly the same need in respect of how the Council develops its business plans, particularly in relation to the coming financial year, which needed to be fully costed as well. I think the information there, this enhances and endorses the need for the CVF-SE sector to be involved wherever possible in underpinning policy development and delivery going forward. And hence we've been working together within the sector with a large cross-section of our sector to develop the coming together plan over the last 6 months. And Karen can carry on with that.
Thanks, Kevin. So I think what Kevin's alluded to is lots of opportunities that are coming for the CVF sector to help play their role in how we shape Wirral. First, I think it's important to recognise the contribution that the CVF sector have made to this piece of work over the last 6 months. Their energy, enthusiasm, creativeness and cohesion has truly made this a really piece of transformational work, and I don't tend to use that word lightly. The Coming Together plan that Kevin alluded to is our way of expressing what's important to us as a sector. We play a really critical role in society and we want to do more. The Coming Together plan is ambitious and we recognise that it's not all within our gift, and that's why we're here today to ask for the support of the Health and Wellbeing Board. The plan itself has 4 key pillars and 4 cross-cutting themes. The first pillar, Influence and Voice, talks about the need to create a democratic representative mechanism which will allow the CVF sector to fully participate within council and partner structures to help shape local policy. The CVF sector have a huge amount of experience working with our communities and therefore have a great amount of insight to contribute. We are clear that we do not want one organisation or person to represent the whole of the CVF sector. We want to build on our strengths and make sure we have the right people with the right skills, reach and experience around the right tables. That way we know we can add maximum value. With robust two-way communication channels, everyone will be involved and we will be able to work with and support representatives in their role. The second pillar, co-production and partnership working, reflects our desire to be seen as equal partners. Unfortunately, there are still occasions where the sector are engaged partway through processes, and we want to be engaged as early as possible. We want to help work with our partners to co-produce ideas and solutions for Wirral. A further part of how we work together focuses on commissioning. Currently, commissioning processes are divisive, and if done differently, we could deliver even more social value for Wirral. So we're asking our commissioners to be brave in this brave new world. The third pillar is health creation. Initially, we were using the term tackling health inequalities, but we felt it was very deficit-based, and we wanted to use language which was more positive. So we've adopted the term health creation. It's a big area. The CVF sector already do so much, but they can do more with support and investment. If we know who is doing what, where, and well, we can connect and build on this quickly, providing even more value for money. The final pillar is volunteering. Volunteering is a key enabler to the CVF sector and health creation. We've seen a huge spike in interest in volunteering during the pandemic, and we want to try and maintain that enthusiasm. We want to modernise volunteering so that it's more flexible, so everybody can give time in a way that suits their circumstances. We want to utilise and build on the strengths of our residents rather than focusing on traditional models that look at the needs of the organisation. We also believe that we can work smarter if we work as a system on this agenda. The cross-cutting themes are the enablers to delivering the plan. The first is around developing the right culture and conditions for collaboration, and this was a really important point that was raised during all of the discussions throughout the thematic groups. We believe it's fundamental to success. If we are truly to work together, there must be a real commitment to address cultural issues and behaviours that have a detrimental impact on relationships. We know that's not easy, but we propose the production of a charter for the Wirral. This will set out necessary agreed behaviours to be adopted across the system and how we manage conflict respectfully. The second theme is around data and insight. So data and insight gathering collectively across CVF organisations can be used to influence planning and commissioning. It will improve the design process and in turn outcomes for local people. Implementing data collection methods and analysis is a specialist role, and it's often difficult for CVF organisations to recruit in isolation due to capacity or funding. If we are to facilitate better data collection and analysis across the CVF sector, we would like to have a dedicated role to support that. The third point is around continual learning. So make sure we learn from what's worked in the past and what hasn't, and use this as a starting point. Let's not make the same mistakes again. And finally, knowing our strengths and building capacity. Wirral has a huge amount of skills and experience within our combined workforce across all of the sectors, and we should make every effort to understand, connect and utilise. Enabling knowledge transfer across the sectors would not only help build our capacity, but also build relationships. So, in summary, we are here today to ask the Health and Wellbeing Board to provide support and cooperation through its membership to enable further engagement and co-production to design and bring forward a more detailed proposal for consideration in March 22. Encourage engagement from partners to support the principles of this plan, develop its implementation further, and help identify investment required to deliver sustainable action. And finally, endorse the establishment of a cross-sector working group whose role would be to co-produce a Wirral Charter. Thank you.
Thank you, Karen. Thank you, Kevin. Questions, comments? Councillor Gilchrist.
Thank you, Chair. What I've been trying to work through is think of hundreds of millions of pounds being spent through the health service and the clinical commissioning group as it is, and through surgeries, and yet beyond that, in the community, there are lots of organisations that are helping people in different ways. And the connection I made in my mind was about social prescribing, which I only really began to think about perhaps 6-7 years ago, where we had GPs who had some information on what was available in the community, but as they got more information on what was available out there, were able to work with local organisations and perhaps help people who are lonely or presenting with various symptoms at the surgeries, to sort of redirect some of them, their anxieties. And because of the virus, COVID and everything else that's happened, a lot of those things that we saw being established have had considerable difficulty in keeping going. So I'm trying to find a way through this that builds on the information, the enthusiasm, all those local groups out there, connecting them to the health service in various forms. And that's where I think we may be able to fit in. I was looking, if you'll forgive me, on page 49, in the way the pages are numbers, it talked about more and longer term investment needed in prevention if we're ever to stop firefighting. That's, I think, where we are, because we need the help and support of local organisations in some structure to carry through that talk in that document about consistent prevention messages. So all those links that people have help get messages across. Now, in the report, on page 55, there's a reference to funding. Voluntary organisations relying too heavily on one source of funding or contract. And then on page 54, there's a mention of a temporary board. Now, I haven't got a picture yet, because I'm sure that Simon and all his colleagues are busy setting up and trying to prepare for next April. There's enough on their plate with that, never mind the current outbreak and all the things that have to be done. From what was said, I see a creative tension, and I want to see how we can harness that to be of benefit to us all. And therefore, if officers have got advice on how some assistance or how some funding can be applied, page 36 on co-production working together talks about offering grant funding where appropriate. It strikes me that there will be ways in which there are funds that our officers are looking after that can be applied to help specific organisations do that work on the ground that I've just been thinking through. I'm happy Simon has his hand up, and so I'm sure look forward to hearing from Simon on what can be done and where we're up to. Thank you, Chair.
So thank that on there. Yeah, thank you, Chair. So as people know me, I spent 5 or 6 years in the voluntary sector before coming into the NHS. So I've got a bit of experience of working in the voluntary sector, but also since then working as a volunteer and a trustee. And we absolutely recognise the diversity of the voluntary community and faith sector, and not all of those organisations want to be engaged with health and care. They have other specific interests. But those that do, we absolutely need to have the door open to and work in collaboration with. And I think what the guidance associated with the establishment of integrated care systems does is it recognises the voluntary community faith sector, so as a body in itself and the organisations therein, but also we need to recognise the people who work within those organisations equally as professionals. So when we talk about clinical and professional engagement, which again there's guidance around about the establishment of integrated care systems, I want social prescribers around the table with doctors, nurses, allied health professionals, social workers, and guiding and shaping our decisions about place development. I would be really interested in, Karen, if this document has been shared with the Integrated Care Board, or whether it has resonance beyond Wirral as a place, because I think it does. And I think there's probably a recommendation we'd want to make for it to be shared with the integrated care system, and I'm happy to facilitate that. The other thing that springs to mind is that this is it's absolutely the right course of action. This is absolutely right to get that place offer in place. But there's also something about how we, as Wirral, develop our governance arrangements for the incoming Integrated Care Board, where the Integrated Care Board docks with the local authority and other partners in this place. And I wonder if there's also a recommendation where we consider in the establishment of the governance arrangements, because there is the place delivery group currently going on, about how that group considers in the future governance decision making of Wirral as a place. We include the VCSE much more with that document at the heart of what we do. So that then starts to address the issues around collaboration, co-production, working on things together and getting to the right outcomes together with our partners in the voluntary community and faith sector. So I think in summary, my first additional recommendation, if it's allowable, Chair, is that we share this with the ICS. My second recommendation is we ask the Place Delivery Group, who also reports here, to consider this report and work at and give us some views about how the voluntary community faith sector can be worked into our future governance for Wirral as a place within the integrated care system, but more importantly for how that links with the delivery of the Wirral plan.
Thanks, Simon. I think certainly on that second recommendation, we're ahead of it because that's already in train and happening. Julie was next, and then Val.
Thank you, Chair, and thank you to Karen, Kevin, and to Chris, and all the people actually that have been involved in bringing this work together. It's a really complicated picture, isn't it? It's a complicated world within which we're operating, and we've been trying to do this work now for a number of years, haven't we? And it's great to see that a number of elements are coming together. And I was just reflecting on Councillor Gilchrist's questions, because there were a number of different comments and questions in there, and I've written down here, you asked around social prescribing, the integrated care system. There's also the wider partnership agenda. You've got Martin sitting next to you as well. It's how do we connect into community safety issues within the borough. We had the young people talking to us just 5 minutes ago. So I think what I wanted to say is I think this is a piece of work, as I said, we've been working on for some time. I think it's very much, we've been trying to grow it from the ground up rather than imposing something on the community voluntary and faith sector. It's not been without its challenges, I have to say, doing it that way, but I think it's the right way to do it. And I think now we're in that space where we need to start to do things, such as with the ICS, so that we can start to shape that. Really welcome the recommendation in here around developing the charter. And I think that's very much a partnership space linked to the Wirral plan about how we all work together, and that will bring in issues such as commissioning as well. And then there's the whole social prescribing, which is really close to my heart, about how we connect with communities and we help people to connect back into to their neighbourhoods. So I don't think I'm giving any answers. I think what I'm just observing and commenting on. I think it's a really good piece of work. I think it's an iterative piece of work, and we've just got to keep going on it. And I think the recommendation to bring a report back again early in the new year will start to build up the story, really, or the narrative of what we're doing, and then also have some very definite deliverables in there of which I think the ICS and the development of the compact agreement, whatever we want to call it, is probably the first two things that we really want to push forward. Thank you, Chair.
Thanks, Julie. Val and then Graham.
Thanks, Chair. So I think that we are at a really important point in our time as a system on Wirral. And I'm thinking about the fact that you talked very much about responding to crisis and not necessarily giving ourselves time to sit back and make plans. So I think this is a really brilliant start. And I know we've been trying to do this for a number of years on Wirral. But as a person who's worked in an organisation that responds to crisis all of the time, it becomes wearing, but it also becomes very frustrating. And if we don't break out of that cycle where we all take account of what you're saying and believe that it's the right thing to do, then we'll always do what we've always done and we won't move on. And for me, it's really important that we change the emphasis away from that crisis response and into much more prevention, because we won't get the outcomes for individuals at the right time for them unless we switch some of that narrative, but also some of the actions that we all have the responsibility to change. And for me, the opportunities that we got through the changes that are coming forward, a document like this with the messages that are in there around actually being in this together gives us the springboard, I think, at this time, within the pandemic, and a springboard out of, which is the right thing for us to do on Wirral. And then we'll start to see some changes and differences to the outcomes for people on Wirral.
Thank you. Equally, I'm very much in support of the content of this report. I think the pillars in particular are really strong. I get a sense of the sector coming together in a different way now, and almost like rebuilding. And particularly I was interested in the co-production and working together pillar within this, because I do think that there's a lot of conversations around collaboratives and around cooperatives in the health sector. And I think there's something here about how the VCFSC comes together in that kind of collaborative approach, and that gives you real strength in place, which is critical to us to get the job done. So for me, it's a very strong piece, and I think expanding on that section around the co-production and working together and really getting some key linkages in terms of our agenda for place, I think is really important. So thank you very much for the report.
Yeah, I can just echo that if there's no other comments. Thank you both very much. That's really helpful to see that the sector is coming together, because whilst you're pushing at an open door in terms of, yes, everyone's saying yes, we want to work with you, we want you to be a part of the plans going forward. It's who? Which organisation? Who do we speak to? Who is it who's involved? Who do we invite on to be a part of discussions? So the fact that the sector is organising itself into groupings where we're going to be able to say, okay, this is what's needed for this particular piece of work, and then as a sector you're going to be able to say, okay, it's this person, this organisation, this way. I think that's going to be really, really helpful, and I very much look forward to the next report coming, so thank you both very much. That moves us, we've got recommendations. Provide support and cooperation through the membership to enable further engagement and co-production. And there will be a further report in more detail in March next year, and that we encourage all partners who are here to support the principles of this plan, develop its implementation further, and identify investment to deliver sustainable action, and authorise the establishment of a cross-sector working group whose role will be to co-produced place-based partnership charter, which I think we've all said is quite an exciting development, to set out agreed behaviours and build strong relationships, which I think all of which will be of huge value in taking the sector forward in terms of how it works with statutory organisations. Really, really important. So I'm happy to move those recommendations.
Suggested.
Oh, and so, what were your additional ones, Simon? It was...
I can share this with the Integrated Care System Development Advisory Group as an exemplar for VCF development. And then you already, Chair, had indicated my second one was being dealt with, but to incorporate this within the development of Wirral Place governance as part of the relationship with the Integrated Care Board.
Excellent. Right, so I'm moving those recommendations, including Simon's additional, well, the additional ones that he's moved. We have a seconder. Julie, thank you. Wonderful, thank you both. Thank all three of you very much for your time. This brings us on to item 7, Wirral Adder, and we've got Gary, Andrew, and sorry, Lisa. Right, Lisa. Hello. So I'm going to hand over. Oh, Lisa. Hello, Detective Superintendent, no less, Lisa Mahan. So we'll hand over to you to present your.
Thank you. I'll just introduce briefly. I think some of you will have seen this presentation before, but it's a new committee, so we've brought the presentation again, but with the added benefit of having Lisa to present the police bit herself today. Just to summarise, this is a big national programme, the ADDA programme. It's part of the government's decision to inject, good choice of words, put additional substantial additional funding into drug treatment and this is on the back of a big report completed and presented by Dame Carol Black earlier this year that recommended that, and the government have picked this up and have gone along with it. So initially we had a universal grant for every area of the country, but then on top of that there was an enhanced grant to some selected areas of the country where the drug problem was seen to be particularly burdensome. The first 5 areas for that were Blackpool, Middlesbrough, Hastings, Norwich and Swansea Bay, and then a second group were added, and that included a Merseyside set of authorities, which were Liverpool, Knowsley and Wirral. And the selection of those authorities was based on the identification of the demand that drug misuse was taking on those areas. So it was numbers of people in treatment, drug-related deaths, and drug-related crime. So those were the indices that selected areas to be part of this programme. So this enhanced group were called the ADDA programme. That is an acronym, but I can't remember what it stands for now. So we were part of the second group, and as the details will come along in a minute, and as a consequence of that, we've been granted substantial additional funding for 2 years. This has now been overtaken last week by the launch of the new 10-year national drug strategy, and that has a funding package with it for 3 years, and that commences next year. So the ADDA programme and the new drug strategy funding straddle each other, but I'll pick that up at the end. Firstly, I'll get Lisa and Andrew to take you through what we've been doing with the funding. The funding was quite prescriptive in what you could do with it, so we had to follow a sort of menu of what they wanted us to do. And we finally got our plan approved in May, and then we brought it through the council. So we've really started to mobilise this in force as a treatment side. Anyway, the police were able to get going quicker than the treatment bit, but in September. So the full mobilisation really didn't start until September. And critical to this is it's very much about partnership, and I think what what we're delivering demonstrates that we've got a really strong and healthy partnership approach to this. So on that, having said that, I'll hand over to Lisa, and Lisa will take you through the police's work. And the police's funding is for Merseyside rather than Wirral specifically, but that's what Lisa will take you through now.
Thank you, Gary. Good afternoon, everyone. I'm Detective Superintendent Lisa Martin. Thank you. Thank you very much. I'm quite loud anyway, so I won't sit too close to it. Gary quite kindly has promoted me to a Chief Superintendent, which I'm not, but it's very kind, Gary, anyway. I told you. I wish. I have the drugs portfolio. I'm the strategic lead for Merseyside Police in the North West for drugs, and that's how I became involved in Project Adder. So, as Gary has mentioned, if we go to the next slide, please. Initially we were given funding. It's across Merseyside, not just Wirral, includes Liverpool and Knowsley, and I'll give some context to that shortly. And it was all around the Dame Carol Black's report and findings around drugs misuse and the need to treat drugs in the right way, as in, if it's high-level criminality, it should be dealt with appropriately. However, if it's appropriate to give treatment and diversion away from drugs criminality to prevent deaths and drug use, then that is what we should do. So it was a whole system approach to enhancing local enforcement, diversionary treatment and recovery was our brief. We worked tirelessly through the spring with the partners, Gary and Andrew and his team, to come up with a delivery plan which is fit for purpose and appropriate to Wirral, which I will talk about today. It is worth mentioning from a police point of view, it does link very closely with some of the work that we do, so county lines, we do a huge amount of work with county lines. We already do a lot of preventative and health work and partnership work, such as what Martin does with his team over on the Wirral, and some of our crime reduction strategies as well as our more pursue type focus. So next slide, please. Okay, so this just gave some context really of why the areas were chosen. So obviously you can see the Wirral and the other areas were Knowsley and Liverpool. No surprise here, but the deprivation and the drug-related crime, clear correlation, and if you were to add other data on top of that, deaths, health, etc., then you would see why those areas were chosen. Next one, please. A little bit of context around Merseyside generally, obviously including the Wirral. We have very, very far-reaching criminality in Merseyside. I go to national meetings and we're certainly on the national map, if not international map, in terms of our drug criminality and supply. And we also, you can see the top left-hand picture there, that was around our drugs and guns footprint around the ENCRO initiative that you will have seen over the last couple of years. And outside the Met, we had the largest amount of criminality related to that, which you'll see the results in the media all the time. You'll see some of the other work that we're involved in. And the reason I put this slide up really is to show to try and look at the difference between the high-level criminality, which were very much around enforcement, taking proceeds of crime, making sure victims have been safeguarded, but also to differentiate those who get involved in county lines at a low level, criminal exploitation. So you can see the county lines, media has been, there's been a lot of that, but you can also see at the top those sweets, they're cannabis sweets. The harm caused by sweets that have got cannabis in across the schools has been significant across the country, and we've done a lot of media around that. So we're looking at the difference really within the enforcement side, but the supportive and preventative side, and then ultimately the treatment with the partners. So if I can go into the next slide, please. So this is a snapshot of the Merseyside Police part of the delivery plan, and we've got numerous government structures in place with the partners involving you know, some joint training initiative, some joint working, particularly Martin and his team, and we enhance each other's work on this. So from a policing point of view, more of a pure police point of view, the investigation side, we put a lot of our money into Red Umbrella to support diversion away from drugs, particularly around sex workers, so we gave £100,000 towards that work. Operation Hammer, we've put a lot of money into, and that's our investigative focus in Merseyside Police, to make sure we get people through the criminal justice process who are our higher end, more hardened criminals who are involved in serious sort of drug supply offences. And we also put some specialist training and equipment around some of our more specialist work, which we need to tackle the highest level of organised crime groups. The financial activity, we've put a lot of intelligence and research into this. So obviously you'll see that with criminals, we can take money off them from proceeds of crime, and that goes back ultimately into our communities. We get a slice of that back from the government, and we're very, very keen that where people have become very wealthy through crime, that money is taken off them, sends out the right message, but it does mean that we can put it back into programmes of work with partners across the most vulnerable areas. The intelligence side, again, the more we put into intelligence, the more we understand what our problems are. And this could be where the vulnerability is, but it could also be where the criminality is or the county lines is going, etc., etc. And we're looking at some new initiatives around dark web, for example. So the dark web criminality increased huge during lockdown, where a lot of our drug dealing now goes online, etc., etc. So we've put quite a lot into some more innovative work. Next one, please. Okay, so carrying on with our enforcement plan, local policing is a really big part of this. Obviously, Martin and his local policing team work very, very closely with the partners on a daily basis, and in terms of real ground level working with people who require support. So under that, we've got the reassurance and the visibility, the county lines and the transport links, criminal use of the roads, and we can target hotspots, as well as some of our intelligence-led interventions. So we have a task force for Merseyside, and they will go into our hotspot areas where there is high crime levels. The next part, the street lifestyles and multi-agency joint activity. A little bit what I just mentioned around Martin and his teams, very much ground level. The staff policing with the partners, getting out on the streets, understanding the problem and referring through to partners where appropriate. The custody opportunities, sorry, could you just go back? We're still on that one. Yeah, thank you. The custody opportunities, this has been really enforced by the funding. So we test a lot of people for drugs under certain categories when they come into custody, and that leads to pathways, if it's not serious offending and they fit the criteria, where there are alternatives away from custody and punitive disposals. So we've put extra staff in there from partnerships where we're able to offer that support lifetime and hopefully give people a chance to get away from criminality. There's no point in them keep coming in and out of the door through criminal justice and then, you know, going back, keep taking drugs and not really breaking that cycle when they need help. So the drug testing capability, we've put some money into our forensic support to try and keep the wheels going, because that is a big area where we don't fully always understand what's in the drugs. And finally, in terms of the enforcement, the communication, so that's everything from raising awareness, preventative campaigns, targeting offenders, showing some of the results, as well as working really closely with communities so we can understand what the true picture is like, and sharing partnership data with our colleagues. So the final slide from me is it's an example of a case from Martin's team, the Wirral Local Policing, working very, very closely with Change Grow Live. and the partners. So this is an individual who was a victim of cuckooing, and what we see quite often is some of the gangs will use youths or addicts or people who are vulnerable through other means, and they will take over their house and make them either hold drugs, sometimes guns, sometimes cash, sometimes make them deal for them, and they're clearly in this trap, and it's very, very difficult to escape. This particular male, he was a victim of cuckooing, and our staff understood the vulnerability around him and worked with the teams here, got him rehoused, got him some drug intervention and rehabilitation work, and some other support which has kept him engaged, kept him away from drugs, and given him a real opportunity to get on and change his life. So this is exactly why ADA is so critical, and it's not just the law enforcement side, it's the lead, the pathways into our partners, that we can actually have these examples where we've actually given someone a proper chance to get away from the drugs, not always criminality, but that kind of lifestyle where they've got positive influence and they get the support that they need. So I'll lead on to Andy. Thank you.
So, sorry, Andrew Cost. I'm the service manager on the Wirral Change Programme. Wirral Ways. So the funding that came in, like Gary was saying before, is split between the three areas. That's Knowsley, Liverpool and the Wirral. And you can see the split that's been taking place there by local authority. The Wirral was receiving 2.8 million in terms of treatment and just over $1 million for police, which equates to 3.88 million over the lifetime of the ADA contract. However, as Gary was saying, that's been extended with the changes that are taking place to the new drug treatment strategy. Next slide, please. So within that, from all aspects, we've got the criminal justice side, which is looking primarily at prison inreach, police liaison and engagement with probation, through to outreach, which I would suggest is working with hostels and working within the town centres. So really looking at a proactive response to people who perhaps are homeless or who are on the streets. And then finally, there's the health treatment side, which is looking at how we engage with colleagues in both primary and secondary care. Also in relation to mental health concerns. And then finally, we've got naloxone. So naloxone is an anti-opiate medication. Essentially, it reverses the effects of an opiate overdose. That can be done via a nasal, a bit like a child's flu spray, or it can be done by an injection. Usually it's the injection that we supply. And what the ADA funding allows us to do is actually enhance that service and create additional roles for people to provide more naloxone in areas that are of concern, and also directly to families who, in support of loved ones and concerned others, to be able to apply medication. So next slide, please. In fact, if we move on to the next slide after that one. Thank you. So, as Lisa has been talking us through, quite a large part of the ADA project is looking at the enforcement side. So from a treatment perspective, we already have what we call the community integration team, which is our criminal justice team. And the ADA funding's really allowed us to expand that team and to enable people to be placed within additional criminal justice areas, so within probation offices, more outreach to prisons, and looking at working more effectively in close partnership work with other organisations to look at connecting reoffending and substance misuse or addiction. Quite often they can be treated in isolation. So what ADA allows us to do is join up that gaps and get people working more effectively together. There's also an increase in funding to allow us to look at diversionary sentencing. So we know that many people will get sentences for relatively minor offences, such as shoplifting, things like that. They'll receive a short sentence in prison and come back out, and that's called the sort of through the gates, the cycle of reoffending. And quite often what can happen is the contacts, the links, the support mechanisms that person has got in the community can be broken by a relatively short period in prison, during which time there isn't enough time for prison staff to engage with that person to really address their addiction. The person comes back out to a kind of broken series of networks. So looking at diversionary sentencing, that's about engaging with colleagues in courts to look at different ways of sentencing people, to provide sentences that are perhaps more enabling of maintaining that person in treatment, and looking at the recovery aspect. And a further part of the work that we're doing is looking at a recovery-centric approach. So connecting people with housing support, with employment and training, but also personal development and creative learning opportunities that perhaps people don't normally get. And that's all those approaches really are to implement a proven through the gates offer. We talk quite often about what would make a good offer. Well, we've got an opportunity now to really put all those things together and make a difference to the lives of people that are using services, but also the obvious knock-on impact of that, of reducing reoffending and some of the antisocial behaviour and criminality that exists in some areas of our communities. Next slide, please. So like I say, yes, Wirral Ways have received a significant amount of funding, but we wanted to look at this as a partnership perspective. We can't do it on our own. So one of the teams that we're working with quite closely is Tomorrow's Women on the Wirral. Specifically looking at how we can work together to improve gate pickups from Style Prison, for example. Quite often somebody will be in prison, they will be engaging with treatments, but then towards the end of that sentence, sometimes people can take a left turn when they come out the prison gate rather than a right turn, and engage with people who are perhaps a more negative experience. What this funding is allowing us to do is to engage with Tomorrow's Women, to go across the Style, purely as an example, to pick that person up at the gate, to get them into treatment straight after being released from prison, and really support them to re-engage with the community and rebuild their lives, rather than potentially that connectivity dropping off when the woman comes out of prison. Next slide, please. And likewise, working with colleagues in probation offices. Quite fortunately, the Wirral Ways office is literally 100 metres away from the probation office on Europa Boulevard. So it's great to be able to make those connections, and even better now for us to actually get the staff and the resources to base ourselves within the probation service. I know as an ex-probation officer that sometimes you don't always get that opportunity to make the referral, to make the contact with colleagues in substance misuse services, to be able to say, go doors down the corridor and engage with that expert, that specialist in substance misuse. That can make a massive difference to be able to manage that person's sentence effectively. Next slide, please. So looking at clinical interventions, which I think is probably one of the highlights of the piece of work that we're doing on the Wirral, and where it sort of stands out a little bit from some of the other projects. We wanted to really focus on the health aspects of the work that we do. So in terms of reducing drug-related deaths, we know from experience that many of the deaths that we have on the Wirral are down to health inequalities and poor health outcomes for people. I think the phrase drug-related death is a bit of a slightly off-key direction in terms of when you think of it, you think of an overdose, when actually the number of overdoses that people die from on the Wirral is relatively minor, albeit one overdose is one too many. The vast majority of people that we work with who die, unfortunately, die from long-term conditions like respiratory issues, cancers, or other conditions that are brought upon by many years of drug and substance misuse addiction. So being able to connect with primary and secondary care more effectively is a way in which we can look at how we can engage what are traditionally termed as hard to reach people, which are easy to reach, and how we can engage those people and maintain their engagement with primary and secondary care. So as a way of looking at that, one of the things that we are doing is working with GPs and potentially looking at how we can create some GP special interest clinics. We've also employed some health connectors, so a key number of staff who are actually there to go to people's houses, to knock on the door at 9 o'clock in the morning and say, you've got a health appointment, I'll take you to that appointment. And look at how we can continue to manage and keep people involved with the with support with the GP. Next slide, please. One of those aspects is looking at mental health, and one of the posts that we'll be introducing as part of this project is a mental health worker who works for CWP. I think it's important that we connect with partners rather than just creating a post ourselves, as that individual will be connected to CWP, they'll have access to systems, and they'll be able to act as the link between that person and mental health care. And if we go on to the next slide, in a similar sense, we've also set up some respiratory clinics with our respiratory service on the Wirral. Already, with feedback from the services that they've seen people who they've not seen for a number of years within our services. The DNA rate is extremely low for those appointments, which is fantastic. And it's a great opportunity, really, just to keep people in treatment, but also to look at it from a preventative point of view too, and bring people into treatment and potentially reduce the risk of some of the long-term health conditions that we see in relation to respiratory care. I think we probably whizzed through quite a few slides there. And if we can go on to the community pharmacy element. So great that we're connecting with primary and secondary care, but also look at how we can build the relationship with our pharmacies more effectively. So our pharmacists really are our eyes and ears. They're the people that are working with patients, with our service users on pretty much a daily basis in many occasions. And they give us some fantastic intelligence about how that person's looking, if they've got any concerns about their health, but also act as an intermediary between the service to pass on messages to ensure that the service user knows when the next appointments are. So the piece of work there will be to build that relationship, to have pharmacy liaison workers who can act as those intermediaries, but also look at doing some specific interventions, particularly around medication, but also look at the harm reduction aspect of the work that we're doing. So engage with supplying more naloxone to people, but we'll also deliver messages about harm reduction and potential healthcare to support a less risk-based approach to that person's care. Finally, if we go into outreach, Nightingale's Cafe is an intrinsic part of our model. I know that a few of you have been to it and have seen some of the love, care and the sort of beautiful nature of the aspect of the work that we do at Nightingale's. And that's connecting with our outreach team, really driving that harm reduction approach, engaging with homeless people, supporting them to receive food, quite simply. So on a Tuesday and Thursday night, we feed around about 70 people who otherwise would have gone without food on those occasions. And what this does is, as part of that ADDA initiative, it gives us further opportunities to connect with healthcare, so increase BBV vaccinations, improve the respiratory services that people receive, and obviously look at things from a harm reduction approach too, so supporting needle exchange and other harm reduction initiatives. As a quick summary as to where we're at, the service, we were able to recruit 26 people. And this has been one of the challenging aspects of the programme for all areas. I think we've actually managed to do quite well on the Wirral. We're still round about, I think there's 3 posts left to recruit to, but the vast majority of posts we've actually got people in, which is fantastic in times when we know there's quite a lot of competition for jobs in this particular field, in the health and social care field. So to get those people has been fantastic. It's enabled us to bring in some people who perhaps normally we wouldn't employ, but with the expansion of the range of jobs that we've got, we're able to bring in a wider range of experience. It's also enabled us to provide opportunities for people with lived experience, people who've been through treatment, people who know what it's like to be in addiction and to work their way through it and to really thrive in recovery. So in all, great opportunities. We're starting to see things turn around. As Lisa was saying, there are some fantastic case studies already about how people have turned their lives around and engaged differently with services. And yeah, really excited about the opportunities that arise and how we can maintain that over the next 3-4 years. Thank you.
Just to add the summary that I offered at the beginning, which is this was a 2-year programme, and on the back of the statements about the new national drug strategy, this is now in effect extended to a 4-year programme, which makes life a lot better with regard to employing people for a time-limited post. So that means that people can engage with this programme now with more confidence that it's not going to get up and running and then get to the point of having to be wound down again. So that gives real opportunity to give this real impact, and it'll be up to us now to demonstrate that impact with the monthly metrics that we're being monitored with from the Home Office. Over to you.
Thank you very much. Thanks for that. Absolutely fantastic project, and it's starting to have some really positive results as well, I think, which is good to hear, and absolutely delighted that the funding is to be continued for a further 2 years. I think that's really, really encouraging, and a really excellent example of how we can all work together and actually come together in a really effective partnership. Any questions or comments for Gary, Lisa or Andrew? Julie?
Thanks everyone. I suppose the question I was asked earlier this week was, how is our drug misuse population changing? So our narrative has been, we've had, because of the heroin epidemic back in the 80s, we've had a large cohort of people who've been in the system for a long time. Somebody said, well, unfortunately, they're getting older now, and therefore does not mean that this isn't such a problem for us anymore on the Wirral. Just wondered what your reflections were on that.
If I can talk about the opiate group first, and Wirral was one of the areas in the country that was highlighted as having a huge heroin problem from the 80s into the 90s. And one of the successes of the Wirral system was that it got people into treatment very quickly, and it got large numbers of people into treatment very quickly. Over the last few years, there's been reductions in funding available, but we haven't reduced the numbers of people in treatment. I think Andrew's service has still got 1,400 people in treatment for opiate dependence. Now, if you factor into that the fact that year on year we lose people who die, they're not all opiate users, but a good chunk of those people will be, and that could be 30 or 40 people a year. And as well as that, we have people who successfully leave treatment, which would be 50, 60, 70 people a year. So that's over 100 people a year coming out of the treatment system one way or another. That number hasn't reduced, so we've still got an influx of people coming into the system as well. So there's still new opiate use taking place in the community, although there are not a lot of very young people coming into the treatment system. On top of that, we've got a changing pattern of illicit use of prescribed medication, which changes, and the online black market, the dark web dealing of drugs. Xanax is a popular one, benzodiazepam, and more recently we've had pregabalin and gabapentin as being popular drugs of abuse. Some drugs have gone out of fashion, other drugs have come in to take their place. And the other drug that is returning with some impact, I understand, I'm sure Lisa will have picked this up with her, but it is cocaine. increasing use of cocaine again, in a different way, but a problematic drug use. So some elements of it haven't changed very much, but some elements of it have evolved and moved on. And then of fluctuating drug use among young people. I don't know if you want to say anything about that?
Yeah, sorry, Gary, I was just going to come in on that. What we see, and it is a relatively small number of people, albeit these are the people that we're seeing. So it'd be interesting to understand what goes beyond what we can see. So looking at young people, particularly around kind of exam time, we do see an increase in the number of people that are accessing support for addiction to prescribed medication like Xanax, like I was referring to, and other meds that they've managed to obtain off the net. I think sometimes people see it as, well, it's prescribed medication, so it can't be bad for me. Well, not if you don't need it, and not if you're taking it at the prescribed levels. When you start to misuse that medication, then yes, it can be a problem. So we start to see those, and potentially we're seeing older people as well, who perhaps have been on prescribed medication for quite some time too. And very often the reason as to why that person was on prescribed medication is quite often being forgotten about. And it's how we can move people on from that place of being prescribed medication and look at some more of the psychosocial impact and engage with them. So perhaps looking at how we can support them with bereavement counselling or other forms of support, alongside the ways in which we can clinically support that person to come off prescriptions.
Sorry, so could I perhaps suggest that we, there's this stereotype, isn't there, of the drug addict? Can I suggest that maybe that's changing somewhat, and that because the examples you're giving there, Andrew, very different type of individual that you're engaging with now.
I think it's certainly changing. What I would say, like Gary's referring to, there is a core group of people who've been in treatment since their early 20s, who are perhaps now in their late 40s, early 50s. The vast majority of our cohort of service users are aged between 45 and 55. So it's an ageing population, and it's a population that are have increasingly complex mental health and physical health concerns. What we try and do is we try and work with that person to see that person as a member of the community rather than a drug user, and engage that person in activities within their community where people will see them as John the referee rather than John the drug user. So I think it's important to do that. But certainly there's a change in face in terms of new people coming in, but potentially it's still that same cohort of people, just in an ageing process.
If I could just add to that, totally agree with everything that's been said there. My concerns really is the widespread use of cocaine right across Merseyside, and it's almost, I wouldn't say normalised among certain people in society, but it's certainly very, very common, and the amount that is actually being intercepted at the ports, not the Merseyside ports particularly, but that is destined for our country, really worries me. So we see a lot of that through the nighttime economy, and also what's going on in Afghanistan. There was some really interesting articles over the weekend around the heroin supply chains, and also methamphetamine as well, both really dangerous, high harm drugs, and that's something nationally we're really keeping an eye on. So something that, really worrying, but something that for law enforcement and partners we need to be aware of. Thank you.
Thank you, Chair. I'd like to commend the work that's been done around county lines. This is often targeting some of our most vulnerable young people. Occasionally, those young people have special educational needs, a group that we've heard from today, and don't understand what they're becoming involved in. Sometimes they're vulnerable because they're looked after in the system in other ways. And it's been a real team effort in sharing information, wrapping around young people, understanding how much they're at risk when they're out of school, looking at how we need to engage them, because if we don't, we know there are people out there that will. And once they have them in that system, then they become either somebody who may be using for the rest of their lives, or somebody that becomes part of that business model, and I have to say it is a business model, and once young people get involved in that, not only are they vulnerable to it, but they're often targeting other young people. So, you know, I thank our colleagues around the table for the work they've done with us around that and the impact that has had.
Absolutely agree very much with that, Simone, thank you. Anything else? Any other comments? Martin.
Oh, it is now. I'd just like to place on record, please, Chair, my thanks to Andy and Gary for the work that they do. I think, and obviously Lisa as well from our own organisation, from a local policing perspective, it has made a massive difference to me and my staff. I think the funding was dropped on us at incredibly short notice, wasn't it? You know, I think we had 2 weeks to get the bids in, and what you know, the team and, you know, all the partnership has achieved in that very, very short space of time is absolutely fantastic. So I'd just like to place on record my thanks from a local policing perspective.
Excellent. Thanks very much for that, Martin. Paul.
Mine's just an observation, Chair, really. In terms of if anyone was in any doubt why the Health and Wellbeing Board exists, I think this is a really good exemplar of why the partners around the table and why it's really important as we move into the ICS that strategic setting that the Health and Wellbeing Board sets for the direction of the place. I think the opportunity that the ICS and the next steps presents, linking it to regeneration and growth and everything we're trying to do around the health inequality and the papers we've seen earlier in today's meeting just brings this all together, and I think Operation Adders is such a really good example of where that partnership working really works and why the Health and Wellbeing Board is really important in facilitating that as well.
Thanks, Paul. Absolutely. So if there's nothing further, then I'm happy to move the recommendation that this Health and Wellbeing Board notes the contents of the report on the progress that's been made so far in delivering ADA, and I hope that we will at some point in the future receive a further update on the progress, because I think that's very much something the board would want to hear at some point next year. Really welcome that. So thank you very, very much for the time, all three of you, and we'll certainly see you in the future. Thank you. Seconder for that? Wendy, thank you. Brings us on to item 8, which is Simon. Tell us about the restoration and development of NHS services after COVID-19, which assumes that we are after COVID. I would suggest that that's actually very far from the truth.
So I think, Chair, this was written a few weeks ago in hope rather than expectation. And certainly events of the last few days have thrown the restoration recovery journey for health and care in Wirral and beyond off track somewhat, although at the heart of both restoration recovery and what we now need to do at the moment is maximising the vaccine programme, ensuring that we retain the integrity of urgent and emergency care pathways, including facilitating discharges from the hospital, but also ensuring within that that people who are most in need get the services that they need. So where we are at the moment in terms of the response to the Omicron viruses, we are doing those things. We are also making sure we're keeping open cancer pathways, access to emergency care, including primary care capacity as well. So this is quite a lengthy report, and it details the priorities that were set for us in terms of restoration and development through this financial year, which was split unusually into 2 half years, one running from April to September, the guidance of which was published on the 25th of March, and one running from October to March of next year, and that was published on the 25th of September. There are 6 key themes in that guidance. The first one is about supporting the health, well-being of staff and taking action on recruitment and retention. And my colleagues in local NHS provider organisations have put several mechanisms in place to do that, because our frontline staff particularly have been battered by the pandemic and continue to work extremely hard, extremely long hours in response to that. The second area of delivering the COVID vaccination programme and meeting the needs of patients with COVID has been, as I said, escalated since the weekend with the ramp up of the vaccination programme, where we are having to deliver at scale whilst also focusing on the most at risk. We're pushing our services now to 12 hours a day, 7 days a week, and we're increasing the workforce available to deliver those vaccines, where we are having to triple our capacity to deliver in a very, very short space of time. Also coming in alongside that are new treatments, some of which I can barely pronounce for COVID, such as dexamethasone, which we learnt about the impact of that in the first wave, molnupiravir, which is an antiviral, and also as of tomorrow, a new service around monoclonal antibodies that's going to be rolled out across the Cheshire and Merseyside patch. The third area is about accelerating the restoration of elective and cancer care, and until the weekend we were making very good progress on this within Wirral, prioritising those people most in need, and we were starting to see both waiting times and waiting lists coming down. It is unfortunate the pandemic hit, because prior to the pandemic we had nobody waiting over 18 weeks, over 52 weeks in Wirral. So we'd reduced our 52-week waiters, and we were then starting to move through the other waiting lists. But as we've learnt during the pandemic, this is not just about elective care in terms of hips, knees, etc. This is also about increased demand on mental health services, and our friends earlier from the SEND group alluded to the fact that actually younger persons' mental health services are under particular pressure at this time, from people who are having new diagnoses of autism, but also are just experiencing significant emotional distress and developing eating disorders as well during the pandemic. The other area we've looked at is expanding primary care capacity to improve access to local health outcomes and address health inequalities. So various programmes were put in place with general practice around that. Part of it did include the total triage approach, but also it's about making sure that there's an offer that includes face-to-face appointments. One of the things we are now doing in response to the latest operational guidance on Omicron is making sure that we retain extended access for general practice during this time. So we are putting a significant burden upon our primary care colleagues, as we're asking them to continue to stay open for people who need urgent access to them, as well as running the vaccination programme at the same time. But certainly we believe that the booster programme is a push between now the end of this calendar year, but also we believe it will also roll into the early part of next year. We also have to make sure we have put steps in place around reducing inappropriate attendances at emergency departments, making sure when people need that care they're admitted in a timely way, but also reduce length of stay, because an extended length of stay leads to deconditioning of people. It means they're much more difficult to care for going forward. But underpinning this, and underpinning also many of the papers we've had today as a health and wellbeing board, is that move to work collaboratively across systems to deliver on these priorities. So the old world of commissioners and providers of acute sector and mental health, the voluntary sector and the statutory sector is gradually being pulled away. And the new spirit has to be about working across organisation systems to deliver upon this, which is really the drive around the creation of integrated care systems and putting place like Wirral at the heart of the delivery of some of those agendas, so they can be close to the people they impact upon. As I said, it's quite a lengthy report. I've avoided going into too much detail. There is a significant amount of detail in there around where we are in terms of performance on some of these areas. Those things are reported in other places. They're reported to the boards of the constituent bodies as well as to the CCG governing body. But I think overall Wirral was on a very strong road to recovery, which was based upon our learning from the pandemic, of working better together, of having the systems and processes in place. And that also puts us in a good place to recover from this, what I hope will be a blip for the next 4 to 6 weeks, as we absolutely focus our efforts on that vaccination programme and on the preserving the integrity of the urgent emergency care pathways. So happy to take any questions, Chair.
Thanks very much for that, Simon. At what's not an easy time, I don't think, for anyone, and I'm very pleased that the overarching direction of this agenda was not lost on you, and that it wasn't just a whole random series of things that got thrown together. Any questions? Phil?
Well, thank you, Chair. I was certainly one of those that was looking for a report that was show us what I was going to talk about, light at the end of the tunnel at one time. But I'm afraid that everything has rather overtaken us. The events have overtaken us, and I can imagine, don't have to imagine actually, when Simon says that staff feel battered by the pandemic, that must be the same for everyone going to work every day, uncertain as to what they'll face and having to cope with what they'll face, and then still come out of it, I wouldn't say not optimistic, but relieved or grateful that they've got through a day and helped people and then survived that day, and to come back the next day and to have to do it all again, possibly with some of the same people who've made some progress over a few days in recovering and then trying to stop them deteriorating. So I can just imagine how awful it is with all this going on to try and make some sort of sense of progress and morale amongst all those services. Simon talked about prioritising and talked to us about elective surgery. And yes, every time I look at press reports, there seem to be that many more people added to waiting lists, and reports will be there must be 5 million people or 6 million people, however many people it is looking forward to treatment. So all that must be incredibly wearing on people who devoted their lives to trying to keep us safe. So I think we owe everyone a great deal of gratitude. In the autumn, there was a lot of, I want to say, anger in inverted commas, concern that GPs were not available, but the health service showed us that they were still there and still available. And there was, I think in the data we saw, there was progress. We could see that the number of people who were being seen face to face was gradually increasing as life returned to something like normal. I'm just wondering, before the world fell in on everyone about a fortnight ago, what the progress might be that could be reported to us, what percentage of people were feeling that they had face-to-face, that they were being seen. Because I got the impression that anger was being replaced by an understanding that everyone was really working round the clock to do what they could in difficult circumstances. So if Simon can say anything on that, I'd be very grateful. Thank you, Chair.
I don't have the exact figures to hand, but Wirral was the last, when I came to Partnerships Committee a couple of weeks ago, we had some data which we shared which showed that Wirral had generally good patient access rates compared to the rest of the UK, rest of England actually. So I won't throw any figures about if I don't have them in front of me, and we could get them. But certainly we were looking for, as it says in the paper, the optimal blend of face-to-face appointments alongside remote appointments. We were reminding practices that an electronic-only based approach was not where we needed them to be. We needed to make sure that people could access practices and supporting them in doing that in terms of not just going back to the pre-pandemic ways of working, but equally not being totally driven by e-consult. And an e-consult itself generates the same amount of activity for a general practitioner as it does for a face-to-face appointment, and is for the digitally literate in our society, it's very easy to access. So there was a direct danger that was starting to tip the balance in the wrong direction in terms of being open to people with long-term conditions, people who are less digital literate, etc. So we could run that data again and have a look at where we are. But we did have some data a few weeks ago which showed the number of appointments we were delivering as a system were higher than pre-pandemic levels, and that the balance of face-to-face appointments and telephone-based were about appropriate. So we'll have a look into that and come back with something.
So thank you very much for that, Simon. We appreciate that it probably wasn't the report that it was meant to be. I think the light at the end of the tunnel, I think there's been a tunnel collapse, Phil, so we can't see the light at the moment. So that was a report for information, so I'm going to propose that we note the report, and we'll simply look forward to a further update at an appropriate time next year. Do I have a seconder for that? Phil, thank you. So thanks, Simon. That brings us on to Healthwatch Wirral. We don't have Karen with us, but she has sent her summary report, which I note in the email Daniel said he would read out, and I see in my notes it says I've to read it out.
I've got it here if you want me to read out, Chair.
Yeah, what Karen says is that the main issues they're receiving are still around access to NHS dentists and difficulties for people using eConsult. There we go. We received 6 calls in 2 days regarding lack of appointments with an NHS dentist, which I sent on to NHSE and have yet to receive a reply. We're now suggesting to the public that they contact NHSE direct. We don't like doing this as they very seldom get a response, but it does provide us with evidence when contacting NHSE ourselves for a response. The public really don't seem to like eConsult. I would suggest they have certain expectations about it and think they're using it as a booking system. Maybe comms to explain exactly what eConsult is being used for would help. We've also received lots of feedback regarding lack of mental health face-to-face support. The demographic information we've gathered on our feedback centre has increased due to a concerted effort, so we can more clearly establish where there are gaps in public feedback. The purchase of our new resource vehicle, which I've seen pictures of it, it's very smart. We will be doing targeted outreach work to gather views and experiences of health and care from Wirral residents who are heard less than others. Our staff team also responded quickly to the Birkenhead Medical Building's plea for extra bodies as the rollout of boosters, etc. hit a massive high. We've had some staff members who volunteer there at weekends. We're also supporting the winter plans by providing a discharge community coordinator role. This role will work with the link workers within the hospital and provide extra support for people once they're home. The discharge community coordinator will call recently discharged people to make sure they're okay and to find out if they're accessing support, care, etc. in the way that they're advised to. The 2 roles, discharge community coordinator and the link worker, will need to build a strong relationship built on trust. They will need to be able to contact each other freely where there are concerns for a particular person, so that things aren't missed. We will be pulling together monthly monitoring of how this is going, good or not so good, for the Commissioner, and we hope to identify gaps in support and provision in our communities. Our interim view visits have been put back on hold as per obviously the increased advice, but we are maintaining relationships with care homes and some dom care agencies so we can quickly pick up our visits as soon as possible. The update that Healthwatch provides the Health and Wellbeing Board is being disaggregated and sent out to GPs, trusts, care homes, etc. following each Health and Wellbeing Board. So if there are questions and comments, I'm sure Dan will feed those back to to Karen Pryor. Otherwise, perhaps we can simply note. Yeah. Oh, sorry, Graham. Yeah.
Just one for me, thank you. I noted on pages 122, 123 and 24, there was some quite detailed feedback really for specific provider organisations, and I think some of that really does relate to how people have experienced those services and what could be done to improve them, and in some cases it does relate to things like, you know, going to accident or going to urgent care with, you know, unnecessarily and those types of things. So what I'm thinking to myself is that there's some really important feedback there for our provider collaborative work in the borough to use as kind of pointers or to help with that kind of improvement journey. So I think what I would suggest is that we you know, take the report as you've said, but also that we feed that specific feedback into the provider collaborative work through Healthy Wirral Partners.
Yeah, I would agree with that. And we can perhaps suggest that at Healthy Wirral Partners tomorrow. So the recommendations are here, and the recommendation is that we will resolve to ensure that evolving systems keep public views and experience at the centre of planning, designing, commissioning and delivery of health and care. Foundations of quality improvement should always have what patients tell us about their treatment and care at the heart of everything. As a system that we plan and do, we must be able to evidence that all actions and decisions made come back to this, making certain that everyone feels respected, involved and valued at each and every part of the journey. We should all feel confident that we're either giving or receiving quality care. I'm happy to move that. Nothing else wants to do. If we have a seconder? Graham, thank you. Unless anyone's objecting, which I don't see any signs of that. Which brings us on to item 10, the integrated care update. Graham.
Thank you, Chair. This is a short update report based really on the emerging governance arrangements in terms of the integrated care partnership. It does emphasise the importance of the Wirral plan and the recognition that all partners support the Wirral plan as the key for our strategic priorities in place. Also recognition of this role, the role of this board in overseeing the planning and delivery against those priorities. There is a lot more detail to come, and I think it's quite important to recognise that the specific governance arrangements, the membership of the place-based partnership and all of those sorts of things will come in the near future, will come to a future committee. At this stage though, the report primarily sets out how the system will work, the objectives of the Wirral partnership that provide, if you like, that kind of way of working. And importantly, our self-assessment is provided in 3.24, which is really our state of readiness for integrated place-based system. It's a very positive report in that sense, and does recognise that there's been a lot of progress made within the current structure. In terms of next steps, there's a lot of detail currently being worked on, though, and I think that, as you'll see in those next steps, that the time frame for delivery is really tight. But of course, the legislation isn't out yet. You know, it's still being sat and dealt with. So, you know, we should see that in the very near future. So further details of the planned arrangements and the governance in terms of this formal structure will come back to the next meeting of this board.
Right. Thanks very much, Graham. Yeah, you're right. There's so much more to come, in so much more detail to come, and I think once we've got that, we should probably set aside a significant chunk of time on an agenda for a very specific and detailed report. But recommendation at this point is that this report is noted. So I'm happy to move that. We okay with that? Thank you, Simon. Right, I'm conscious that time has moved on, so we do need to crack on with our next item. I think we've had so much fascinating stuff on this agenda. I'm not surprised that we've got to the time we've got to. But we did say we would do an item on joint strategic needs assessment, which is really, really important and could be absolutely vital for everybody. So I'm going to hand over to Julie on that one. Thanks, Julie.
Thanks, Councillor Nolan. And actually, I'm going to hand the baton over to Bev Murray, who's our lead for the Public Health Intelligence team. Bev's just going to take you through a swift, now unfortunately, Bev, given the time, introduction to the JSNA, so that people are aware of where it is on the site and how you can access it. We just really wanted to make sure, because people talk about the JSNA a lot, wanted to really have that conversation with you, and it's probably going to be at another time, about how we want to develop it so it very much is driving the business and very much driving the health and wellbeing strategy. But I'll be quiet now and hand over to Bev. Thanks.
Thank you, Julie. So yeah, as Julie said, I'm Bev Murray. I'm head of the Public Health Intelligence team. As you can see, there's quite a detailed report in the agenda pack. What I'm going to try and do is bring you a presentation that brings some of that to life at speed. Next slide, please. So what we've got here is the first questions around what is a joint strategic needs assessment. So I've just put a really basic summary at the top in terms of, it's bringing together data intelligence that helps us to understand the needs of our population. And I've got two visuals there. So the left visual is in the detailed report, and that's literally a collaboration model for the JSNA. And you can see there's a combination of national inputs, so national policy, national evidence, and certainly from a public health intelligence team, we are constantly horizon scanning, looking for relevant insight and evidence that we can pull into our JSNA and our Wirral Intelligence Service website. And then obviously there's a big element that's linked to local inputs, and that's bespoke to the Wirral area. And again, it's linked to identifying priorities, identifying local data, and more importantly, utilising local expertise. On the right side is the Wirral, and I'm going to bring you back to that. I'm going to refer back to that in the next slide. And that's really just some key words and key statements around how our JSNA will be. So things like detailed needs assessments, collaborative, agile, responsive to change, local and relevant to our populations. And if we do all of that in there, it will lead to stronger partnerships, which we've talked a lot about today, and between communities and all our partners, and the wider partners, providing a firm foundation for action to reduce inequalities. Next slide, please. So the intention was to make this interactive, so I've put some buttons at the bottom, so feel free, once you've got access to this PowerPoint at your leisure, click on them buttons and it'll take you straight to the pages that I'm referring to here. So this is what our homepage looks like in terms of the Wirral Intelligence Service and the JSNA. And the blue ribbon at the top is our main contents page. And there's some tiles below that where it's just a quick route in to our website. But what I'm going to do is, I suppose the one thing I'm going to raise on here is at the bottom, there's subscribe to our Wirral Intelligence Service emails. We send out a newsletter every 6 to 8 weeks. If you sign up to that, you will get a newsletter that will describe all the work we've done, the recent work, and any published evidence that we've published onto the website. So you can be first in the know if you sign up to that newsletter. Next slide, please. So again, this is just the next step. So I suppose I've just tried to think if you're not familiar with using this website and accessing the JSNA, I'm going to suggest 2 routes in, and certainly the 2 routes I use quite often. So at the top there, if you click on local needs, it will take you straight to the JSNA page, which describes the JSNA, the legal guidance on, the statutory guidance on the JSNA. But more importantly, there's a section below highlighted in blue that says by A to Z and local reports and evidence. So what I use quite often is the A to Z, and if you click on that, it will give you the alphabet, and if you're thinking you want to search for something related to cancer, which I'm going to show you an example in a minute, click on C and it'll give you all reports that we've done that with the topic area beginning with C. So really easy. If you're not used to using the website, I would encourage you to use the A to Z. I use that quite a lot. A good tip for me is the next little bit at the bottom is the latest reports. And what we do is, if you're not particularly looking for a particular subject matter, and you just want to see what's the latest reports, and for example, the Public Health Annual Report, and the latest, we've just recently done a Cheshire Merseyside cancer needs assessment. If you click on local reports, and the box at the bottom is just a screenshot, it will bring you a list of the latest reports we've produced and published on the website. So again, if you're not familiar with the use of the website and the JSNA, I would encourage you to either click on A to Z, but more importantly, it's really good to click on that latest report, because then you can see the most recent insights and intelligence and evidence we've developed. And I think as you become more used to using it, you then find your own way of accessing the website. So next slide, please. So this is where I said I'll take you back to that Wordle with the keywords in. This is 3 examples, 3 very different examples of how we bring together data and intel to understand the needs of the population. So the top left-hand corner, when I describe detailed needs assessment, collaborative, we have just recently produced a Cheshire Merseyside cancer needs assessment, and this was very much from a collaborative approach. So it was all of the Cheshire Merseyside Public Health Intelligence Analysts, which is led by CHAMPS, the Cancer Alliance and NHS England, and collectively we pulled together all the insight and co-produced this needs assessment. So it's a very detailed needs assessment covering a range of key areas from risk factors, prevention, impact of early stages of the pandemic, survival, palliative care and mortality, and it's right up to the minute information. Having said that, it is 80 pages long. So what we've done on that cancer front page is we've also given you access to that detailed report, but we've also produced a presentation that summarises it. And then what we have done is for each of the sections, we've just summarised the key sections. So we've put a little summary for risk factors, a summary for survival rates. So you can really decide how you want to glean that information if cancer is one of your key topic areas. The top right-hand corner is a very different example, and that's very responsive to change and an example of being agile. And that is there's 3 different reports there. The focus is on COVID statistics. So as you know, none of us had a plan for COVID. It happened, and then from a public health intelligence perspective, we had to quickly sort of respond to that in terms of giving the public and our partners the statistical information on COVID. So what you'll see there is the main Wirral Council page that we provide daily statistics on COVID. And then what we have got on the Wirral Intelligence Service page is more detailed data again, and we look at we do a weekly report, and just in the bottom hand corner there where you can see the Wirral Peninsula, And that's a report that's quite visual and breaks down the demographics and gives you the epidemic curve. So it's providing different ways of interpreting the information for different audiences, and that very much is aimed at the public as well, so we can get those consistent messages out to the public. So we're using one source of the truth, both for the public, internally for our organisations, and you know, regionally as well. So that's a really good example how we've been really responsive to a major change and had to be agile in terms of producing that really vital information. And the bottom hand left-hand corner, again, this is linked to sort of the Wirral again around being local, relevant to our population and responsive to change. And this is very much in development at the moment. So we have a plan to produce a state of the borough, and how we're going to approach that is we're going to approach it as an interactive tool, an interactive dashboard. So very different again from the very detailed needs assessment to daily statistics. We're now going to develop a state of the borough as an interactive dashboard, and that's just an example at the bottom left-hand corner there of some of the headings that we are planning to develop. So each of those headings will become a interactive report. And we have got a holding page for that basically states it's in development and coming soon. So we are currently scoping that. And again, this is about providing insight and data using key metrics, benchmarking, that will help us understand Wirral as a place. And particularly a big part of our scope in that development will be about aligning to our Wirral plan and aligning to the Marmot goals and the Public Health Annual Report. So we really get an understanding of the place on Wirral and provide that insight to our partners and our stakeholders. And I think longer term as well, it's really the approach lends to the fact that if things change, we can, and data changes, we can update that quite quickly, as opposed to going back to the drawing board and redoing another report. So the plan is to make that really iterative and automated so we can update that. So 3 very different approaches to insight. Next slide, and you'll be pleased to know this is the very last slide. So how do we need to develop it? And this is where it links into the recommendations in the paper. So the ask from us is, you know, to develop a joint strategic needs assessment work plan for 2022-23 that focuses on wider determinants. And to support local action to reduce health inequalities. The ask is for the Health and Wellbeing Board to play an active role in the collaborative partnership approach to ensure all partners are working collectively in Wirral to understand shared priorities and support joint decision making. And I suppose I've just put at the end there that it's our JSNA, so it's not Public Health Intelligence JSNA or Public Health. It's all of our JSNA. So it's only going to ever be as good as the user feedback and the engagement and the collaboration. So I think that's a really key message that I would like to get across, is that we can do all this fabulous work in the website, but if no one is using it and taking action from it and collaborating and making it best it can be, we've got to question why are we investing all our time in that work. So finally, by using the range of all those existing tools, including the interactive approach to some of our data and intelligence, this allows us to have one version of the truth for all our stakeholders to use. And we have a rolling JSNA programme of work that is carried out by various partners that contribute to the knowledge about the topic area. So we don't have a rolling programme that we write a very in-depth report and we might get to review it or refresh it every 3 to 5 years. So it's about making it relevant and useful for our partners, engaging with our partners. And Also about linking to other relevant local, regional and national reports that can be used to avoid duplication. So if we think of the model right at the very first slide, the horizon scanning, let's utilise some of the published national reports and make use of those, as well as complementing our local expertise and knowledge. And finally, more importantly, allows regular reports to be brought to the Health and Wellbeing Board on key topics. And this means that the board can actively engage in understanding the needs of the population and develop the priorities for the work plan. That's it for me. Thank you.
Wonderful. Thank you very, very much for that, Bev. At speed as well. That was a quick dash through. I always stand in awe of people who can process and take data and turn it into useful information that I can then use, because we always seem to be drowning in data and sometimes searching for the information that we should have as a result of that data. So I absolutely love that Wirral Intelligence Service website. It's one of my favourite places to go rummaging about for information. I really do. But also I have to say, over the years, I've always found that police have got amazing data and information as well, that I absolutely welcome the partnership working similarly with our health partners as well. And I know that many partners in health share my frustration about being data rich and information poor. They're conversations we've had, Val. But yeah, if we can work together, that's the whole point yet again, this whole theme of integration. And if we work together, we've got much, much more effective information that we can use to improve our services. So thank you very, very much. Bev, any comments or questions for Bev? No? Keep at it and keep coming back, and keep coming back with the reports that I'm absolutely certain this board will be asking for on a regular basis. Thank you. Moving the recommendations, do we have a seconder? Wendy, thank you. That takes us to the work programme. Vicky's going to present that.
Chair, thank you. This is the standard report that's brought to every meeting of the Health and Wellbeing Board and allows members to contribute to the work programme. There is already a significant number of items on the work programme which are contained in the report, but this is the opportunity if members would like to comment upon any of those, or if there's anything further you'd like to add.
Thanks, Vicky. Anybody wanting to add to the workload? Simon?
A note, Chair, that CCG finances is pending, but clearly the CCG subject to legislation won't be here after the 1st of April 2022. So if you wanted to pull that forward, we could get Mark Chidgey to do something around that.
Yeah, I suppose I'm just questioning whether that's something that we really need to do at this point, or given that we will shortly be seeing the demise of the CCG, how relevant that is at this point. I know all the mopping up is being done in the preparation for the move into the ICS, so I'm not sure what value it would be.
I think from my perspective, Chair, that's absolutely right. The mopping up needs to be done within the place-based work, but for us it's also about maximising the Wirral pound in terms of the ICB monies in the system. So we'll be doing that in terms of making sure we're very clear what's in the Section 75, but also what other opportunities exist for pooled budgets at place going forward. So that's all part of the work.
Do I have a proposer for the recommendations with respect to the work plan? Right. Oh, well, I'll propose it then. I'll propose the recommendations. Nobody has suggested any further items. We appear to have decided that we don't need CCG finance reports at this point, but we will certainly be looking to ensure where the pooled fund and Section 75 monies sit in respect of Wirral's governance and the ICB. So we will be looking at that as a board. Okay. So perhaps we can reframe that that item rather than CCG finances. Look at pooled fund arrangements for the ICS. Perhaps if we reframe it into that, I think would be most useful. And perhaps look at that at the when's the next board?
February and March, Chair. 9th of February and 23rd of March.
Maybe the 9th of February? Okay, 9th of February. In that case, appreciate that it's been a long meeting, but I actually think it's been an incredibly useful one. I think we've seen a really wide variety of really important projects that are valuable to all of us, and hopefully we'll all take away from what we've seen. And I mean, that they're not just there for people to go, oh, isn't that wonderful? That they're actually there for us to recognise what they can mean in terms of our own particular organisations, and also what we can learn from how those particular projects have really impacted in terms of integrated working. But on that note, I wish you all a very, very happy Christmas. Assuming that we still have Christmas, let's keep our fingers crossed that we are actually all heading into Christmas. We've got masses and masses amount to do in the new year, so I look forward to seeing you all then, suitably refreshed.